vaccine, and we will have a certain level of immunity in the community. But this year is different. It's now up to us. As the governor said, the vaccine is coming, and it sounds as if it's going to be very effective. It's 95% effective. They're starting to get it available to be distributed probably in December. But in the meantime, we have to do our very best. All of you that are watching, please do your best. That means wearing a mask, always wearing a mask, washing your hands as much as you can, using hand sanitizer whenever you can. Limit your gatherings. Keep them very, very small with social distancing, or have them just not at all. This is not the year to have that big Thanksgiving dinner, which I do, by the way, every year. I cook for 30 people, and I'm there, and everybody looks forward to it. I mean, we really like it. We play games and watch movies, and it's wonderful. I'm going to miss it this year, but we're not going to do it. It's just too dangerous. Not only because of where I work, but because, you know, we're all out in the community, and we can carry it around. You can have this virus. It's a deadly little virus and never even know you have it. The other thing about this virus is that, yeah, you can get over it, but it has some long-term consequences of it in terms of cardiovascular disease, in terms of neurologic disease. We've seen many, many patients who come in, they get over the disease and then come back or have a heart attack or a stroke while they're still in the hospital, even though they've markedly improved in other areas. This has some effects on the vascular and neurologic system that we're not truly aware of yet, but it's there, and it can happen in really young, healthy people. So this is not something you want to get. This is not innocuous. We have to do everything we can to keep away from it. Next Thanksgiving, I think it'll be really nice, but not so much this time. We will, as the governor said, have this vaccine coming. And it's going to take a while to get us all vaccinated. In the meantime, everybody needs to do their very best. We're a country and a state that have had to sacrifice many things over the years. You know, the world wars took sacrifice. You know, there were rations and all kinds of things. So wearing a mask and washing your hands and limiting your contact in the big picture is not so awful, especially when we know that help is coming and help is along the way. The other thing I wanted to mention is what we've seen at St. Vincent's, and we have a very large behavioral health unit, is that we're seeing more and more behavioral health emergencies. This is hard on people, staying home, schooling your kids. You know, it really is very difficult not being able to get out, not being able to go to family gatherings. And so, you know, we're seeing more and more. It's just something you should be aware of. And we should pass on to our fellow citizens, you know, look for signs of mental illness, of depression, and get help. Our emergency department visits have gone way, way, way up in terms of behavioral emergencies. So be aware of that and pass it on. I hope you all have a very happy Thanksgiving. I will be sitting on my front porch waiting for kids to stop by and say hello. It'll be very brief, and we're not all going to get together at the same time. But I hope you all have a very Thanksgiving, and I can promise you that Thanksgiving in 2021 is going to be much, much better. Thank you.